Hello everyone, this channel focuses on mental health for life. And our psychiatrists and mental health counselors introduce you to various mental health knowledge that is easy to understand and useful for your life. This time, we are focusing on hyperventilation attacks and panic disorders. Most people who visit the emergency room complain of cardiorespiratory symptoms such as chest pain, dyspnea, and palpitations. But almost half of them do not have any internal organ problems on examination and are suffering from psychological anxiety attacks. In this way, anxiety attacks are a very common disease. Anxiety attacks are triggered by anxiety and cause automatic abrupt symptoms such as chest pain, palpitations, dizziness, breathing difficulties, numbness in arms and legs, stomach pain, and diarrhea. Even without a direct psychological cause, they can develop from accumulated stress, lack of sleep, or excessive exercise. Especially when accompanied by a strong fear of dying or going crazy, they're called panic attacks. The most common type of anxiety attack is the hyperventilatory attack, which is seen in women from adolescence to their 30s. Officially, it is called hyperventilation syndrome, a condition in which breathing becomes difficult and heavy after anxiety or fear. It can also cause palpitations, chest pain, numbness in the arms and legs, cramps, and even fainting. Anxiety and fear cause overstimulation of the precipitory center, resulting in rapid breathing and low carbon dioxide levels in the blood. This does not cause death, however. One well-known treatment for hyperventilation attacks is the paper bag method. In this method, a paper bag is placed over the mouth and breathed into to increase the amount of carbon dioxide in the blood. But recent research has shown that it is not effective. In addition, death have occurred due to respiratory problems, so the paper bag method is not used these days. Generally speaking, for anxiety attacks, the best way to deal with them, other than medication, is breathing exercises. Basically, it is to breathe slowly with long exhales. You need to exhale at a pace of counting to 7 and inhale at a pace of counting to 3. Abdominal breathing is a good way to achieve slow breathing. Women tend to breathe from the chest more than men, and if you have experienced anxiety attacks, you should practice abdominal breathing on a regular basis. If you experience an anxiety attack once, it may be repeated over and over again. The nervous system remains in a state of excitement that makes it easier to have an attack, and a similar situation can trigger another attack. Especially, panic attacks with strong anxiety and fear are likely to be habitual. Even more troubling, as anxiety attacks become habitual, you become anxious that you will have another attack. This is called anticipatory anxiety. Anticipatory anxiety can trigger attacks. Anticipatory anxiety causes you to think more and more, trying to beat it out of your head, and your nerves become agitated, which turns on the attack. Even when you're taking a bath after a long day's work, you may become anxious thinking about the attack, which may cause you to have an attack. When these repeated panic attacks and anticipatory anxiety occur, the condition is called panic disorder. The first panic attacks of panic disorder often occur on airplanes or crowded trains and the like. After that, it does not improve and becomes habitual because people always use trains for commuting and other purposes. As it worsens, they become distressed, not only in trains, but also in narrow spaces, movie theaters, crowded supermarkets, and so on. Anticipatory anxiety can also make it difficult to be alone and even to stay at home. In addition, this condition can lead to social withdrawal and mental depression. In some cases, drinking cures the anxiety and the person becomes dependent on alcohol, leading to alcoholism. Panic disorder is a condition in which the brain's natural ability to detect danger is overreacting. For example, if a fire alarm is set to a sensitive setting, even a little cooking will set off the alarm. Likewise, the brain's alarms for danger have been set to a sensitive setting in panic disorder. But you cannot change the brain settings back to normal on your own. To reset the brain back to its normal settings, the brain must naturally recognize that it is safe. To deal with panic disorder, the first step is to reduce worry, overwork, and lack of sleep. In mild cases, breathing exercises may help, but psychiatric medication is more effective. If untreated, it can become chronic, so please do not hold back and think, I can manage it, but rather see a psychiatrist promptly. Taking anti-anxiety medications during an attack can control the attack and is effective for anticipatory anxiety. This confidence in the ability to deal with attacks with medication leads to spontaneous healing. By keeping a sense of security, the blind's alarm system will soon return to normal. If you experience repeating anxiety attacks, such as hyperventilation attacks, suspect panic disorder. It is common to be diagnosed with panic disorder when you thought you had a heart condition. If treated early, it can be cured in a short period of time, but panic disorder takes a long time to be cured. Many people take drugs for more than 10 years. Take your time and let's treat it. This is Mental Health for Life channel. If you liked the video, please subscribe to our channel and give us a high rating.